That is good morning, good evening, wherever you are here in this world. That is, I am getting that is many appreciation mail from my US friends, different companies in Europe, Brazil, and other different countries and India also. So regarding my everybody are requested for bigger, little longer video. So today I am trying to that is trying for 10 to 12 minutes video. We start with manufacturing unit. There is a USFD audit observation. Please see spillage of water from the top gasket. This water supplies to API manufacturing unit. Listen carefully. So that is response, how to respond such type of cases. Deviation initiated and leakage of top gasket rectified, training imparted. Second observation, there are not written procedure for production and process control designed to assure that the drug products have the identity, quality, and purity they purport or are represented to process, especially the 100% visual inspection of field capsule conducted period to packaging is performed manually. So, so these observation actually in Germany, when I have been there in one company, there is no written procedure describing this process. So this is a crime. This has to be whatever you have to do. It has to be done according to the SOP. That is training specific to this manual operation, lightning requirements, capsule rotation, and control of the volume of the capsules. So, see, this is each and every point you need to that is follow, understand, and that is this will really this type of things. If you see my response, this will really help you to shape your career in future. How to address such type of that is USFD observation. How to respond. This is the response. SOP is revised to include the training specific this manual operation, lightning requirements, capsule rotation, and control of the volume of the capsules. So I am talking slowly because you should understand each and everything. That is the reason. Third observation is auditor. You initiated an investigation dated on these emanating from mold contamination result. This is related to the mold contamination result. Read on dated in your grade A filling area. Grade A filling area. It's very critical. This event resulted in the rejection of approximately batches of finished product manufactured on filling line. This investigation is inadequate because you did not appropriately identify the scope of the investigation, establish the root cause and implement preventive action or initiative the investigation in timely period. This observation is you listen carefully. This big, very big observation in the manufacturing, pharmaceutical manufacturing area. You suspended production activities dated on these after 3 mold isolates were recovered in this area and to establish the root cause. You visually identified apparent dried product residue on the other side of the lyophilization tray bed product path dated on this. You made no attempt to identify this residue. So these are the discrepancy and their carelessness. So maybe they don't know. Maybe junior that is that is production people, operator, supervisor is dealing with that. So this is not the way to deal. Has to be senior has to do. You sampled the area of the residue which resulted in the recovery of 11 CFUs of mold on dip. You identified additional mold isolated near this affected area procedure procured from apparent product residue. You identified a potential source of contamination and sampled these are without conducting a scientifically established sampling plan or worst case sample location. So we you return to manufacturing during late December this dated. You identified inadequate cleaning as a cause for the apparent product residue on about this date. You identified additional apparent product residue on approximately this date, same location it was identified dated on this. So see, each and every point is very important, and you have to follow, take care of this, because such type of problem are very common in the manufacturing area. So what to do, what not to do, how to do, who will do. So how to deal with this, how to respond USFD audits observation. This is the response. Reinvestigation done and reassessment perform. Reinvestigation and reassessment, these things, such cases we have to do. Media field plan to implement the kappa. So the this is the, you understand, that is, these are the two things, reinvestigation and reassessment you have to do for these cases. Then third observation, you identified an activated product dated on this unit critical defect during your retained examination on dated on these, the lot number of this. You identified an inappropriate reincorporating ejected product back into your product stream for a root cause. You modified your written procedure on approximately this date and implemented these preventive actions on approximately this date. You did not perform any immediate action to prevent this reoccurrence in this interim. In this manufacturing, you have to always keep in mind, if you face any problem, see any problems in the manufacturing, try to rectify and document it, whatever documents are there immediately. Don't wait for tomorrow, do it right now, otherwise you will forget after some time, and the auditor will come, notice it, and they will give you the 483. What is the how, that is, you will respond such cases. Investigation initiated to get exact root cause. SOP to be revised to include immediate action to prevent this reoccurrence. So you have to understand what I am talking about. This is one observation when I have been in Germany in one company. This is the situation. The fourth operation, you initiated an investigation dated on these because of a potential data integrity. See, and even associated with an in-process auditor and part PR ID number. This auditor perform visual inspection. Just imagine, operation affecting approximately lots manufacturing from this date through this date. The investigation is inadequate because you did not specifically justify why you choose to analyze the retained data of approximately lots. See each and every point, see, that is, you have to, that is very careful. Manufacturing is too critical in pharmaceutical, especially injectable, and also the injectable oral drugs, ophthalmic. So these are the most critical. But compared to, I'm talking about compared to the solid dose product. So you have to be very very careful how to respond such cases. So these are the problems what I'm discussing here. This is the here there are many negligencies there. That is the supervisor negligency in the manufacturing. QA people not review the that is process document. So they think that is they will take care of later. In industry, there is tomorrow is too late. You will always think like that. If you observe anything critical, major, minor or critical, you have to take the action immediately, rectify the problem, properly document. No manual, no data integrity is how to respond such cases. Response deviation initiated, investigation done, and training imparted to all concerned. I am talking about in industry. Training is routine training. I am talking about. There are many pharmaceutical company are not doing. They are doing only the paper, not physically. This is the basic points again and again I am talking about. That is routine training. You have to is very very important. You have to take care of. So I will come with more attractive, little longer, that is 10 to 12 minute video as per the request from my friends and colleagues from USA, India, Europe, Vietnam, Japan. I got. Thank you very much for listening.